Seeing some familiar names on there, so welcome back. Welcome, everybody. And it is 12 o'clock, so we are going to go ahead and get started. Today, I just want to welcome everyone to our Nursing Home Quality Essentials, and we're going to be talking about the role of the IP and what a day in the life could look like. My name is Kara, and I am one of the quality improvement facilitators here with Telegen. And Carolyn, who is also a senior quality improvement facilitator, will be joining me today and helping with our session. Next slide, please. With our contract extension, we are pleased to be able to offer our nursing home quality essentials on Tuesdays and Thursdays, spotlighting infection control. So join us each week if you can, so that you can enjoy our wide array of infection control topics. Next slide, please. And be sure to add us to your trusted list of contacts. You can also find us on Facebook and LinkedIn, and we have those links provided here for you on the slide. Next slide. So today we're going to be using Mentimeter, and we're going to go over the instructions, and this is the QR code for Mentimeter. So there's going to be a few times throughout the session that I'm going to be asking you questions through Mentimeter. So if you can use your cell phone to access Mentimeter by scanning that QR code that's on the screen, or you can open your browser and log into menti.com and enter the code that's on the screen there. The Mentimeter responses are all anonymous, so you don't have to worry about anyone seeing your responses. And each Mentimeter question will auto-populate as we reach that place in the PowerPoint. So please keep your browser and your phone open, and we'll be using that throughout the session. Next slide, please. So today we're going to talk about a day in the life, the role of an infection preventionist. And I just want to start by saying, as we begin today, this is not a complete detailed list of everything that that an IP would do in the role. Rather, this is going to be a brief overview and kind of give you a glimpse or a look into what a day could look like for you as the infection preventionist. Next slide, please. So our objectives for the session today are to describe the role of the infection preventionist. We're going to discuss kind of the day-to-day and possibly month-to-month responsibilities that you will have, and also look at and come up with organizational methods to ensure compliance as your role as an IP. Next slide, please. So let's start with the IP responsibility and what those responsibilities mean to you and your facility. Just to review from the CMS manual, the responsibilities of the infection preventionist are to collect and analyze and provide infection data and trends to the nursing staff and healthcare practitioners, consulting on infection risk assessment, prevention and control strategies, implementing evidence-based infection prevention and control practices, including those that are mandated by regulatory and licensing agencies and guidance from the CDC. So as we begin, I also want to mention that if you are the IP or you're a DON or administrator on the call and you have an IP in your building, if you don't already have a backup IP person, I encourage you to establish a backup. That person should also be trained in infection prevention and control and be able to jump in if you get pulled away to the floor or you are out sick. You may also be able to delegate to your backup person if you have other fires to put out or other emergencies come up. And I also want to mention that being the IP needs to be your sole focus. This role wears many hats. And what do I mean by that? If you're the IP and you're also the DON, or you're the IP, but you're also the wound nurse, this can be extremely problematic. For some small facilities, this may be doable, but for some of those larger facilities, this could affect compliance, audits, keeping everything current and up to date. I know in my own experience, so often in homes, the IP struggle to keep up for these exact reasons. So I recommend that you consider having a backup person for those sole reasons. Next slide, please. So here on this slide, we have provided a list of F tags that can be associated with infection control. Be familiar with these tags. They're going to guide your day-to-day work that you will do, and it's also going to help you identify proactive measures to put in place to address these areas. And with it being December, if you have not reviewed these tags, especially that F883 and that F887, I encourage you to do that as they relate to the respiratory season. Next slide, please. So before we dig in, I want to share with you Telegen's Infection Prevention Orientation Checklist. This checklist will address the following areas. It's going to ensure a review of the infection prevention scope of responsibilities, the IP plan and goals and updates to department policies and procedures, a review of the facility emergency preparedness plan that you need to make sure that you're aware of, as well as your COVID plan. You should also review and understand the annual plan and training requirements for your staff, your quality assurance and performance improvement, which is your QAPI, and your role with the QAA committee, including what data should be collected and sharing during those QAPI meetings. And if applicable, reviewing those corporation policies also. And finally, a review of your respiratory protection program and any implementation of one if your facility does not have one already. Whether you're new to your role as an IP or if you've been in this role for a while, if you have not already done so, we encourage you to conduct an initial ICAR, an initial infection control tour in your building to establish a good baseline and an action plan for any findings that do not meet your infection prevention standards. This is going to help you know where you are as a facility and where any gaps are that need improvement. And you can check out our checklist on our site, and I have that link in the bottom of the slide that's provided for you here today. Next slide, please.
So one of the tools that I feel like is essential for any IP to have is a contact list. Um, do you already have one of these handy? If not, it would probably be beneficial for you to establish a specific point of contact with all of these agencies that I've listed here. As the IP, you're going to need to ensure that you have that point of contact for the organization, just to make sure that if there's something that arises, you can reach out and be able to get in contact with someone. It's great to have these at your fingertips just for easy access. If you have questions or support or um, for anything that may come up in your role as an IP. So you'll get these slides, I believe Friday or in the next few days. And, just you might want to look and make sure that you do have contacts and that you have numbers and that they're readily available for you when you do get this list. Next slide, please. So, what does a day in the life of an IP look like? Well, the role of an IP is all encompassing. Pathogens, they lurk in every nook and cranny in your facility. As a versatile IP, you are engaged with all the departments of your facility to prevent transmission. Although each day is going to present unexpected challenges of its own, at the core of an IP's day are key components such as surveillance, mitigation, education, data analysis, and dissemination. You're always going to have those kinds of things, but each day may look a little bit different. And you should still have, even though that day is, each day is going to be just a little bit different, you still should have an organized system to ensure that you're meeting all of your required duties, um, and that your purpose is being carried out in that IP role. So, what is your purpose? It's to provide safe, sanitary, and comfortable environment and to prevent the development and transmission of communicable diseases and infections. We often get requests from new IPs on where to start or what they should be doing. So today we would just like to share with you an overview of what a day in the life of an IP might look like. And we also want to hear from you out there. What are some great ideas and what does your day look like in the facility? How do you organize yourself? Like I said, this is going to be different for everyone depending on your organization, depending on maybe other roles and duties that you have. But this is just going to give you an idea of what you should have, and that's why that IP orientation checklist is a really good thing to have and check out that Kara mentioned earlier. Remember that this is not every detailed task that we're going to cover today. It's just kind of a general guide to help you know where to start or how you could possibly set up your day and organize yourself. Next slide.
So this is going to be our first Menti question. So make sure you have out your phone. You can join at menti.com if you haven't and put this code in. So our first question is, what is the first thing that you do in the morning to start your day? This is after getting your morning cup of coffee, saying hello to everyone, putting your things away. When you're going to start your day as an IP, what is one of the first things that you do in your role? If you can enter your answers in, there's no right or wrong. Like I said, everything is anonymous, so we'd love to see what you do when you start your day. And many of the ideas that you put on can help some others that might be a new IP on the call today. We're seeing quite a bit, checking the 24-hour reports, 24-hour reports, checking emails, run infection antibiotic reports, checking for new antibiotics, read through the previous day's charting. Again, all the communications, 24, 72-hour reports. Walking the halls, talking to staff to see if anyone has any new concerns, or resident stop and watches. Audit to see anyone displaying infection, signs or symptoms, or antibiotic use. A lot of really, really great answers. Thank you so
Really
much
great
for
answers.
putting those in. Next slide, please. So many of you put a lot of really great ideas on there. So here's an example of what your morning could look like. Let's say you head to your office and you're first going to browse through your emails and you're going to look for pending labs, outstanding cultures, any diagnostics from the day before. Are there any pharmacy emails or emails from providers regarding new or current antibiotics? Looking at those 24-hour communications like he talked about, has anyone been placed on isolation? Are there any new COVID positive residents? New staff or resident illnesses? And addressing all those new illnesses first thing to ensure that all measures are put into place and that staff are notified to ensure proper monitoring and swift action and interventions if needed. You're also going to take a look at new admissions. You're going to look if they were admitted on an antibiotic. Do they have a history of infections? And if so, you're going to look at initiating prevention measures and making sure that those staff are aware that those residents are at high risk for future infections. Review their admission paperwork, looking at their assessments for completions, their risk of infection and other disease processes, and also their immunization status. The morning can be used for checking in on all of the happenings that have taken place within the last 24 hours and that they are addressed and managed right away. Next slide, please. So based on what you found during your morning review on your computer or overnight happenings, possibly the next thing you could do is it's time to do rounds throughout the building for infection control compliance. Again, this is not a full list of things to look at, but are just examples of items to inspect during your daily rounds, like your resident rooms. Are they clean? Are the nasal cannulas covered? Are the neb machines covered? Do bedpans, are they kept in bags? Looking at that trash, looking for clutter in the rooms. Isolation rooms, is the appropriate signage up? Is the PPE well stocked? If you have anyone on isolation or COVID positives, you're going to follow up and ensure that PP again is set up, the staff is aware, and all infection control measures are in place. And stopping by, looking in your soiled utility. Are the bins overflowing? Is there PPE for staff to wear when they're using the hopper? Are there plenty of biohazard bags and the big boxes that you package them up in? Is there stuff stored in there that shouldn't be stored in there? What about hand hygiene signage in your soiled view? And do you have soap or a sink in there? Do you have hand hygiene available for them in the soiled utility? Looking at your med rooms. Are they organized? Looking for that temp log on your fridge. Are there expired meds in your fridge? Are there drinks or food just sitting about in your med room, which oftentimes we see? Um, Overflowing sharps containers, supplies laying out. Then taking a look at your therapy room. Are they clean? Are you noticing, are there cleaning products to clean everything that they're using in there? Is there hand sanitizer available for the residents when they're in there? Same thing with activities. Are the communal activities that they're using is it all washable? Can it be disinfected? Is there sanitizer available? If they're doing morning exercise when you get there, are they social distance? What are you seeing when you're watching them in activities? These are just a few areas that you can look at, but some additional things to look at are like your shower rooms, your wheelchairs. Are your wheelchairs clean? Are they being cleaned? Are there any rips or tears in the arms and the seats that are going to impact your ability to disinfect those? When rounding, you're going to look at your catheter bags. You're going to make sure that those are covered for infection control purposes. Um, as you're rounding, take a look at your residents that are up and getting ready to go to meals or at meal times. Take a look at their hands. Take a look at their nails. Are they clean? Do spot checks in your bathrooms. Check in all of the wall dispensers for soap and hand sanitizer, ensuring that those are not empty. And also, when you're walking around the building, observing your own staff and observing their infection control practices. And if you see something, don't wait to tell them. I always encourage IPs and anyone doing tours that if you see something, to stop and just do a small education with them right then and there at the moment so they can learn as they're going along. At the bottom of this slide, in the bottom left, we've also provided a link, and this is to our COVID-19 infection prevention and control rounding tool. This is also going to assist you with rounds, not only daily rounds, but also looking for specific things to look for, even on a weekly, monthly, or yearly basis of things that you should be looking at, reviewing, and checking. So I encourage you to check this link out at the bottom of the slide. Next slide, please.
So another thing that often happens in the morning in facilities is a morning meeting or a stand-up meeting. And all facilities have their own process or structure for their morning meetings. They also have their own times, of course, for the morning or stand-up meetings. But as a suggestion, it would be good to try to make those rounds before you attend your morning meeting or your stand-up meeting if you can. That way you can bring any issues or concerns that you find while you're doing that rounding or that tour to those meetings. But be sure to get clear expectations from your leadership for your morning meetings and what they do expect you to report on. Um, this is just an example. You could take your logs, maybe your laptop, anything that you use for tracking. You might want to take those things to your morning meeting with you. And if there's something to report on, or if maybe there's questions about something that's going on as far as infection prevention and control. Also, be prepared to report on any new infection prevention and control related items that you found on the 24-hour communication. Any new admissions with infections, those new admissions or new infections, including COVID-19. Make sure that you are definitely reporting on that, and not just in your morning meeting, but you're sharing that out with your staff as well, so they know who is on isolation and why. Um, they definitely need to know why and what that is for. Any new COVID cases, both resident and staff, you want to be sure to report on that. Any infection prevention and control audits that are happening or have been completed and what the findings were. Any dated COVID-19 guidance. You want to make sure that everyone in your leadership team and on the floor is aware of any updated guidance that's out there, not just for COVID-19, but for any infection prevention and control that would have to do with their job role. And if there's any upcoming trainings related to infection prevention and control, that would be good for any of those departments. Now, since infection prevention and control is all encompassing, meeting with your environmental services and dietary and other departments weekly or monthly is recommended. You need to discuss appropriate cleaning products during this time, the disinfection and the dwell times. How long does it need to stay wet on those items in order to ensure effective disinfection? Responsibilities of who cleans what. Is there personal protective equipment available for them to use? Um, if there's some kind of failure with personal protective equipment, uh, who do they notify, and what's the follow up for that? And making sure that any new environmental services or dietary staff receive the proper education on facility infection control policies for their daily responsibilities and for COVID. Also, follow up if any audits have been done in those departments, and those use those audits to identify any gaps for use for quality improvement. Next
And
slide,
Carolyn,
please.
I
Go
would
ahead.
like to add, everything that is reported in your morning meetings, whatever you take to morning meeting, whatever outcomes are, if anything new is going to be implemented, if somebody new is going to be taken off of isolation, put on isolation, anything that is discussed in morning meeting, you also need to ensure that you have a system in place for relaying and ensuring that your floor staff is getting that information. So you have to have good
Absolutely.
communication to be able
Yes.
to relay those morning meeting topics and what has taken place and what's going to happen to your staff out on the floor.
Yeah. Next slide, please. And that does lead into the next slide, Kara, is making sure that anything um, that happens in that morning meeting, any information that needs to be relayed is taken care of, and that does get relayed to the floor staff. Um, Especially if you have someone who is on orientation, and it's really important that all of your new staff do go through infection prevention and control orientation. Those new hires definitely need to know what your processes are, um, what the specific PPE that they need to know. Um, it's just really important that they are aware of those policies, and it's the perfect opportunity to introduce new faces to the infection control standards and expectations in your facility. Now, all orientation should include that, again, that infection prevention and control component for your staff to understand the significance of certain practices, and they also need to know where to locate resources regarding your infection prevention and control. And should they have questions, um, where should they go with those questions? So here is a list of some of the things that you might want to cover during your infection prevention and control orientation with your staff. Um, Also, another thing, so that they know where their PPE is located. If they have someone who is in isolation and perhaps they're out of something like gloves or gowns or something like that, where do they locate that to refill it if they happen to run out? Those are the kinds of things that they're going to need to know too. Next slide, please.
So after you've completed your morning meeting, there's time to do your training. If that's the time in your day that you've decided to do your infection control training, now it's time to sit down again at our computer. Um, Review your tracking. I like to use this time to review tracking and surveillance logs, start looking for trends with UTIs, catheter-associated UTIs, and any uptick even in respiratory infections, as an example. You're going to pull data, identify areas where additional audits can be done, targeted surveillance and education that needs to happen. You know, something else, tracking stock of PPE and ordering it if that is your role, or notifying someone, whoever does the ordering, as you're checking all that PPE supply. Updating the immunization log, ensuring that all the forms are uploaded, determining vaccination rates and who is due for annual immunizations. Possibly use this time too preparing for NHSN reporting, if that's what you do, or if you have to provide information for the person who will be doing the reporting. Again, if applicable, ordering infection control supplies. Work on training content for upcoming in-servicing. If you use Relias or another training platform, even ensuring that that is getting done and evaluating those results from those trainings. That's going to let you know what additional training needs to be done. And as a side note, I encourage you to use real time when it comes to updating all of your tracking and your surveillance logs on a daily basis. You know, I always told my IPs or my managers to always be ready for public health. Always keep everything current and up to date. Because if they come in, whether it be for an annual or for a complaint, they're normal. The minimum they're going to ask for is they would like to see 3 months worth of this or 6 months worth of this. And so making sure that you're taking this time in your day to sit down and add all those things and to keep all of your immunizations, all of your antibiotic stewardship, everything current and up to date is very important. Next slide, please. So our next Menti question as we move on is, how much time is spent on vaccines in your role as an IP? So to be more specific for this question, I would like you to guess, or if you know, how many hours you feel you spend on your vaccination program a week. If you had to guess. Thinking of all things that are included in your vaccine program.
Now we
Okay,
know
for
someone had put in here, Kara, it depends on the time of year. And that's true. You know, in the fall, there's a lot of time spent on getting those influenza consents and preparing for that as well. Let's
yes.
just say in right now in this time frame, here we are at, what is this, the first week of December? What are you looking at as far as your time spent on vaccinations? Because that's quite a big chunk of your time as an IP, but it's not all of it.
Mm-hmm. Exactly right. We're seeing a lot of different responses there. Taking into regards new residents and staff and reviewing vaccines for NHSN reporting.
Mhm. Yeah, and I'm
Uh,
sure the size of your facility also
yes,
dictates a lot of that as well.
absolutely. Absolutely. Next slide, please. So the reason I asked that question is because a major factor in infection prevention is the strength of your facility immunization program, both for residents and for staff. And all of that should be offered. So staff and residents should be offered the influenza vaccine annually and the pneumonia vaccine as recommended, of course, and the COVID vaccine, including any recommended booster doses, must also be offered. The immunization focus is not seasonal. And this is kind of what, when we looked at those answers and Carolyn talked about this time of the year, that immunization focus is not just seasonal. It should be ongoing throughout the year. So be sure to carve out time to keep your program current and up to date. And remember, one thing when we're talking about those immunizations, flu, pneumonia, COVID, and those that even declined, remember that all education, consents, declinations, not only need to be documented, but also should be uploaded into your EHR system to show proof that you have educated the resident and the family member on the risks and the benefits of those vaccines. And I say that because when we work with homes, oftentimes we will see that as a tag because there's not proof that that education is being done. So I definitely wanted to bring that to your attention. Again, here we provided another useful resource for you in the bottom left corner. This is the link to the Intelligent Vaccination Hub. And this link is all things vaccination related. It has a lot of really great resources and tools that you can use. Whether you're new or you've been in IP for a long time and you're wanting updated resources, anything like that to give to your residents, family, and staff. Next
Okay.
slide, please.
This
Oh,
is
what time?
Yep, we're just about at time.
Okay. Okay. Then I'm
Um,
just going to briefly go through then. We have here on the slide additional tasks to consider in looking at as an IP. And then our last slides are different systems that you can use to help organize yourself. I apologize for time. We have the spreadsheet. Spreadsheets are one way to organize your day, your week, your month, creating a spreadsheet with a tab for your daily duties, weekly duties. This can also be shared with your DON, your administrator, so that they're aware of the duties that you're working on in your IP role. Another system would be a checklist you can have a checklist template. You can print it each day and you can check it off. You can add to it. As the new things are being delegated, you could add to that checklist. And then actually using a calendar of days. It's a different way to organize yourself. If like I'm going to do infection control trainings on Tuesday, I'm going to do immunizations on Friday, I'm going to do data extraction on Thursdays. This style of organization will allow you to structure categories and also help other managers know what you're going to do, and it can be beneficial when you're setting up future meetings and reports. So here's our resources. We've added some additional resources. At the end of this presentation, you're also going to get a survey from SurveyMonkey that's going to pop up. We do encourage you to complete that. This provides really valuable feedback for us here at Telegen, and we would love to hear your thoughts. And so are there any questions? I'm sorry I had to go through that end rather quickly as we were running out of time, but are there any questions at this time? Okay. Well, if you do come up with any questions or you need some assistance, feel free to reach out to us at Telegen. We have our general inquiries and our nursing home at telegen.com listed here on the screen. And you can join us every Tuesday and Thursday for our nursing home quality essentials. And on the 10th, we have NHSN office hours. On the 12th, effective auditing. And the 17th, transforming rounds into effective action. And I just want to thank everyone for joining today and look forward to seeing you on future sessions. And you should be receiving the slides in the next couple days. Thank you so much. Have a great
thank
day.
you.